meeting number 5 of the House of Commons Standing Committee on Health. Today we are meeting in public to continue our discussions and reach decisions on the committee's future business.
It's kind of difficult now.
Today's meeting is taking place in a hybrid format pursuant to the House Order of November 25th, 2021. Members are attending in person in the room and remotely using the Zoom application. Regarding the speaking list, the committee clerk and I will do the best we can to maintain a consolidated order of speaking for all members, whether participating virtually or in person. I would like to take this opportunity to remind all participants to the meeting that screenshots or the taking of photos of your screen are not permitted. The proceedings will be made available via the House of Commons website. Given the ongoing pandemic situation, I would ask that we respect the recommendations from public health authorities as well as the directive of the Board of Internal Economy of October 19th, 2022. Colleagues, at our last meeting, we were discussing an amendment from Mr. Davies on the motion of Mr. Bertod to initiate a study on children's health. And we also made a decision at our last meeting to set aside time to receive a short presentation from our analyst, Sonia Norris. However, we are not bound to finish those things before we move on to something else, but I would suggest that it would be in good order for us to finish those things at some point. And with that, the floor is open.
Point of order, Mr. Chair.
Mr. Chair, on the chair chat, you have the names of some members.
I see in the speaking order we have Dr. Hanley, Ms. Kramp, and Mr. Bertod, but I recognize first Mr. Davies with a point of order. Go ahead.
Oh, thank you, Mr. Chair. No, it wasn't a point of order. I was just going to speak to the to your suggestion.
Okay, so we're going to put you on the speakers list then. Someone raised a point of order, and I'm not sure who it was. So can someone help me out with that?
C'était Luc Berthold, Monsieur.
Luc Berthold, Mr. Chairman. I just wanted to point out that a number of people had raised their hands here in the room.
Oui.
Yes, and I was informed by the clerk in the room that it was Dr. Hanley, Mr. Kramp, and yourself, and the fourth person would be Mr. Davies. So thank you for that assistance. And Dr. Hanley, you have the floor.
Merci. Thank you. I would, in the spirit of restarting, but acknowledging I would also like to continue discussions that we left off. But I would like to begin by notice of motion that I have circulated, and that's a revision to my previous notice of motion, and that is to address the healthcare workforce crisis. I can read the motion, but I'm not sure if I'm happy to read the motion, but I'll take that at your direction. But essentially, it is to undertake a study on how the federal government can facilitate recruitment and retention of healthcare providers, including a focus on rural and northern communities, and that this be the first study undertaken on the understanding that we have the COVID studies starting already, but that it be the first alternate study, and that in recognition of the workforce crisis and the role that the federal government plays in addressing this, I propose that we put this as our first study. Thank you.
Thank you, Dr. Hanley. And just so that we're clear, are you giving notice of this motion or are you moving this motion now? Because if you're moving the motion now, it would be in order and it would be appropriate to debate it now, but I need to be clear.
Règlement, Monsieur le Président.
Oui.
It's a point of order? Yes, go ahead, Mr. Thériault.
I am moving the motion.
Okay, Monsieur Thériault, avec un appel à règle.
That was a point of order? Yes, it's a point of order. You open this meeting, and I have a feeling it's going to be quite long. You open this meeting up by starting with a question as to how we operate, and you asked about our opinion on the way we should operate. This issue was really to ask us the following, and I'd like to remind Mr. Henley and others the following. Would it not be a better idea for us to continue with our discussions on Mr. Berthold's motion and everything with respect to the studies, that issue that we wanted to work on, and then see what the analysts have to say regarding the documents that have been sent today? You're asking that question, Mr. Chairman. Hands go up, and then you give the floor to the first person who seems to raise his hand, Mr. Hanley, sending us off in a completely different direction that totally disregards your question. If that's how we want to operate at the Health Committee, I understand why it takes 2 hours and 15 minutes to then finally arrive at some discussion and some vote on Mr. Berthold's motion. I would point out, Mr. Chairman, that there are people watching us. And if we're trying to be consistent, if you're asking a question of that nature, then I think I would expect the people raising their hands would not simply try to take advantage of their time to then impose a new priority. I would hope there would be fair play, Mr. Chairman, and when that is the case, one would start by answering the question asked by the chair if these are issues of operations, if you will. That just makes perfect sense to me, and it seems to me here we have Mr. Hanley presenting his motion. You should have called him to order and said, listen, that's neither the question nor the answer to the question I asked, because you specifically asked the right question, and I was expecting that colleagues who raised their hands at that point would actually reply to your question. So I would ask that we be a bit more rigorous in the ways in which we undertake these debates, because otherwise we will simply not get out of this. We will continually be trying to discuss what program we want to engage in. And sorry, Mr. Berthold, Mr. Thériault. Actually, it's Mr. Thériault, sorry. Thank you for this point of order, but it is the committee's decision to determine the order of questioning. It is true that at the last meeting we did some work that we haven't completed, but it is appropriate to put those debates in a certain order. I mean, that's what Dr. Hanley has done, and I think it's allowable. So we now have before us a motion, and the debate will be on that motion. If I understand you correctly, Mr. Chairman, you're basically asking us a question to open the meeting here, and then one person decides to impose a whole other discussion on us before we've even completed the discussions on a motion that we were preparing to vote on. So now we would be suspending the discussion and the vote on the official opposition motion to now launch into another discussion on a motion that was actually not at all planned for. I don't feel we're anywhere near solving this, Mr. Chairman.
Okay, Mr. Thériault,
Mr. Thériault, I've taken my decision. I'm not sure I asked a question. I simply made a comment about the fact that we hadn't completed something that we'd started, but the chair Well, actually, that was the committee decision. The fact that there was a motion that was put forward indicates that there's at least one member of the committee who wants to start with that, and it is his right to do so. We will now debate the motion before us.
I want to
Okay.
speak to Mr. Terrio's point of order, if I
Very
could.
well.
I just want to just get a clarification on this. I understand the ruling, and I understand Mr. Terrio's point. But I just want to get a clarification that when one of our members gets the floor and, you know, Mr. Terrio or one of our members or someone else, and just simply moves a motion to adjourn the debate on Dr. Hanley's motion, that's non-debatable, right? So then we would just have a vote on that? Because I'm
That's
just
correct.
pretty much signaling where this is going to go if the Liberals continue to derail. Like, it doesn't make any sense. We almost came to a vote. We just simply ran out of 2 extra minutes of time at the last meeting where we could have come to a resolution. If we're interested in moving forward as a committee in a productive, meaningful way, Mr. Terrio's point is well taken, and you know, we would absolutely be supportive of finishing the conversation that we were having last time, and then we can get to other motions that other members want to bring up. But it makes no sense at all to go down the road that we're going down right now. We know where this is going to go inevitably.
Thank you, Mr. Lake. Ms. Cramp Newman, please.
So a motion to adjourn? Adjourn that motion, sorry. I take that. Adjourn the debate.
I take you want the debate to be adjourned, not the meeting. Is it the will of the meeting to adjourn debate? Do we require a standing or a standing vote? Mr. Clerk, what's the room look like?
You want to talk? Recorded vote,
Okay.
Mr. Speaker.
So, yeah, okay, so the motion is to adjourn debate. It is not debatable. We'll proceed directly to a standing vote. Mr. Clerk, if you could please conduct the vote on whether the debate should now be adjourned.
Recorded vote on shall the debate on motion of Mr. Hanley be adjourned? Mr. Hanley.
I vote no.
Nay. Mr. Jahari.
Oppose.
Nay. Mr. Poleski.
No.
Mrs. Sidhu.
I vote no.
Mr. Nur Mohammed.
I vote no.
Mr. Berthold.
Oui.
Yay. Mr. Ellis.
Yes.
Ms. Cramp Nyman.
Yes.
Mr. Lake.
Yes.
Mr. Thériault.
Oui.
Mr. Davies.
No.
Mr. Chair, nays 5, nays 6, yeas 5, sorry.
Could you
Motion
repeat, please,
is-
Mr. Clerk? I didn't
Yes,
understand those.
I will be clear. We have 6 nays and 5 yeas.
I declare the motion defeated, and next on the speakers list, we have Mr. Berthold. The debate is on the motion.
Merci beaucoup, Monsieur le.
Thank you very much, Mr. Chair.
I've been waiting to speak to the point of order. So I don't know if you are, and it seemed to me that what we were voting on was to adjourn debate on the point of order.
No, what we were voting on was to adjourn debate on Mr. Hanley's motion, and that was defeated.
I'm sorry. Well, I had wanted to speak to the point of order. I don't know where that leaves us.
We don't have any more point of order, sir.
The point of order has been ruled upon, and we've moved on. So
Okay.
I'm sorry about that, Mr. Davies. Mr.
That's okay.
Betod, s'il vous plaît.
All right, well, I'm going to raise a point of order of my own at this point then. And my point of order, I think, is to sort of, I think it'd be helpful for the committee in our future proceedings to know how we're going to proceed. I was a bit taken aback at the way this meeting began, as my colleague, Monsieur Thériault was. It's been my understanding that when a meeting is adjourned, as the last meeting was, when you start the new meeting, we don't pick up where the last motion was. It's a brand new meeting. At least that's my understanding. And although I understand totally, Mr. Chair, you were trying to be helpful, and I appreciate that. I just think if that is going to be the way that the committee proceeds, we should know that. I'm not even sure if that is permitted or not. Perhaps the clerk could elucidate on that. But it's been my experience that when a meeting ends, the meeting's ended, and the new meeting comes, it's a brand new open floor, which would have made Mr. Hanley's motion in order. But I think we need to know that if we come to a new meeting, whether or not we're picking up where we were at the last meeting or whether we're starting a brand new meeting. That was my assumption, was that it's a brand new meeting. And I would suggest, regardless of what flexibility you may have, Mr. Chair, that I would suggest to my colleagues that we proceed on that basis, because I think it's clear to everybody then that when we come to a new meeting, we pick up, it's a brand new meeting, and whoever gets the floor gets the floor. And of course, we follow the business that has been prescribed for the meeting. It was my understanding that what this meeting was called for was that we were going to receive a briefing from the analysts on the evidence that was received in the last Parliament on the COVID study. So that's what I came prepared to begin the meeting with, to hear the briefing. And then I thought maybe at the end we might deal with committee business. Now, I'm in my colleagues' hands. If we prefer to deal with committee business, we certainly can, if that's what the majority want to do. But I do think it'd be helpful for me anyway, and I think most of us, if we know what the procedure is going to be when we come into a brand new meeting. I would have thought, like when we were debating Mr. Berthold's motion last meeting, and then I had moved an amendment to it, and then I believe it was the Conservatives, if I'm not mistaken, who moved to adjourn the meeting. When that happens, that meeting's killed, and I don't think we come back to this meeting picking up where we left off. At least that's my sense of it, and I think that would help if we have that clarified. Thanks, Mr. Chair.
You're exactly right, and that's exactly what we did. When the last meeting was adjourned, this one starts anew with committee business. There was a motion put on the floor, and we're now debating the motion. You are correct that at the last meeting we made a commitment to hear from the analyst, and we made a commitment to complete the debate on the previous motion, but that doesn't necessarily give them precedence when you start with a clean slate at the next meeting, which is what we've done. Betod, s'il vous plaît.
Mais alors, Monsieur.
Mr. Chairman, on this issue of clarifying things, why did you start the meeting the way you did? Because then you introduced a form of bias that doesn't, is not consistent with what was just said. Just one moment, Mr. Chairman. You've repeated this point 3 times, says the chair. It's no longer a point of order. Unfortunately, the interpreter is hearing 2 people at the same time and cannot make that call.
Non, Monsieur le Président, c'est pas un débat.
No, Mr. Chair, that is not a debate. You are asking Mr. Davies. You give Mr. Davies the opportunity to clarify the meaning behind the adjournment of other meetings we've held, and then he asks you to clarify the situation and to say exactly where things stand vis-a-vis our last meeting. The way in which you opened up this meeting does not really allow us really to follow the path presented by Mr. Davies. So humbly, Mr. Chairman, I'm raising that your comments quite simply allowed for Mr. Hanley's motion to be tabled, even if he was allowed to do that from a consistency point of view and in terms of how we organize our work. I would think that common sense would lead us to solve that first question. That being said, we'll be quicker next time around.
Le débat est sur le...
The debate is on the motion. Mr. Berthold, you have the floor.
Oh. J'ai la parole, monsieur le...
I have the floor? Yes, okay. Sorry, I was having a hard time following. Thank you, Mr. Chair. I'd like to put forward an amendment to Mr. Hanley's motion. In other words, to remove the last words that are not in the written motion, but that asks that this report, that this study be the first one in a set of studies we're going to be carrying out. I would like that to be struck.
And the debate is now on the amendment. We have Mr. Davies. Mr. Davies, please go ahead.
Sorry. Well, I was going to ask for clarification of the motion. My staff put together a number of motions for me that have been filed on this. I'm pretty sure there were several versions of a motion that were put forward. So I think it'd be helpful if the clerk read out the motion of Mr. Hanley, if that would be possible. Because if I'm not mistaken, there was more than one version. I may be mistaken in that. But I'm not really...
You're absolutely right. And the latest version was presented today. Sorry to interrupt. Go ahead, Mr. Davies.
Thank you, Mr. Clerk, or Mr. Chair. That would be helpful then, I think, if you read out the motion for all of us so we know what we're dealing with. Thank you.
Does the clerk have a copy of the motion? I presume probably in the room.
I do.
Okay, if you could read out the motion that's before the committee right now.
Absolutely, Mr. Chair. This notice and motion from Mr. Hanley, dated Thursday, February 3rd, that pursuant to Standing Order 1082, the committee, in recognition of exhaustion and burnout among healthcare professionals, undertake a study of how the federal government can facilitate the recruitment and retention of physicians, nurses, nurse practitioners, and other healthcare providers to the public healthcare system, including a focus on rural and northern communities. That this study be prioritized by the House of Commons Standing Committee on Health in the 44th Parliament, that the committee experts and representatives to appear, that the committee hold a minimum of 8 meetings with witnesses on this study, that the committee present its findings and recommendations to the House, and that pursuant to Standing Order 109, the committee request a comprehensive response to the report by the government.
There you have it, Mr. Davies. Now that you have the motion before you, do you still have an intervention? You okay?
Well, I do have an amendment, but I think Mr. Berthold had an amendment that he wanted to move before mine.
And he did, and the debate is currently on the amendment, which essentially removes the words in the motion that have this as our first order of business. So next, we're going to go to Mr. Lake, please, on the amendment.
Okay, there we go. I'm not sure. I'm just trying to find where I'm looking at the motion as it's in the digital binder, but I can't see the reference to it being the first order of business. So there wasn't one. He just added it at the end?
Maybe I can clarify.
Yeah, Mr. Lake, I'm not sure that the motion that was presented today is the same as the one in the digital binder. That may be the problem. Dr. Hanley, do you want to respond?
Yeah, my apologies. I think I read a previous wording. I think we had changed it to prioritization because we recognized that it was not the first study. But what I think the essence of what I'm trying to propose is that before the studies that we're presently discussing as next in line, I propose that this be the first of those because of the urgent nature of addressing the healthcare workforce crisis.
Mr. Lake?
Taking out the line that this study be prioritized by the House of Commons Standing Committee on Health in the 44th Parliament. Just to be clear? Okay. I support that.
Thank you, Mr. Lake. Mr. Johari, please.
Thank you, Mr. Chair. I think prioritize is the right word. And before, if my colleagues indulge me, I just want to start by thanking the Sonia for putting the summary of the testimonies from the previous Parliament, specifically on the COVID-19 pandemic collateral effects on page 3. I want to highlight the paragraph, and this talks to the point of why this study should be prioritized, not necessarily the first one, but near at the top. And I quote, and I'm reading from page 3, paragraph number 4. The committee heard that more needs to be done than simply addressing the backlog since the healthcare system has been stretched for years. Prior to the pandemic, Ontario was in need for an additional 20,000 nurses, according to Mrs. Worthwood. Today, 5 million Canadians do not have access to family doctor or primary care teams, according to Dr. Collins. Furthermore, about 2/3 of Ontario nurses reported in 2019 that their work environment was fair to poor, and almost as many as 60% was considering leaving their job, 1/4 of whom intended to leave the nursing profession. Dr. Lunang worried that those healthcare workers who were taken out of their area of specialty to deal with the COVID-19 surges, such as surgical nurses, might not return. So this is just one aspect of the healthcare resources that they're in crisis. They were in crisis before, and they're going to be continuing the crisis. So I definitely support not only doing this study, but prioritize it because it's impacting our ability to be able to provide the healthcare support that's needed. Thank you, Mr. Chair.
Thank you, Mr. Johari. Mr. Thériault, s'il vous plaît.
Monsieur Thériault, vous êtes sur mute.
Mr. Thériault, you on mute? I did not raise my hand, Mr. Chair.
Dr. Hanley, please.
Thank you. I want to speak to the amendment as well as the motion itself. I do believe that this should be prioritized, so I do not support the amendment. And I'm thinking of Dr. Ellis himself, who in question period today referred quite passionately and eloquently, I will say, to the burden on healthcare that the pandemic has exacerbated, and to Canada's exhausted workforce. So I'm confident that we have support in the room for a national conversation on Canada's healthcare workforce and what federal levels and mechanisms, or federal levers and mechanisms, can be used to pave the way for recruitment of healthcare workers and reform the way we think and deliver healthcare. And this is, as we know, this is well supported by the Canadian public, by the Canadian Medical Association, the Canadian Nurses Association, the Canadian Association of Occupational Therapists, many other healthcare, the Canadian Pharmacists Association, many other healthcare associations or agencies. So I do think it speaks to the urgency of addressing this, particularly as our mechanisms to get through whatever else we're thrown at with the pandemic, that we need a robust healthcare workforce. If we're considering de-escalating public health restrictions and mandates, we need a strong healthcare workforce to be able to rely on this. And I know that healthcare workers themselves are watching us. And I know to Monsieur Berthold's point, Canada is watching us. They have a lot of expectations for this committee, and I think that among the many valuable motions that have been put forward, this is the one we need to look at most urgently. Thank you.
Thank you, Dr. Hanley. Dr. Pawlowski, please.
Thank you. Maybe I should just save myself a long speech and just say I agree with Brendan. But being a politician, I won't. So two things. One, we do have the most members in Parliament, so it doesn't seem totally crazy that we get our study in first. I certainly support the Conservative study, and I like your study. I like your children's study, and I'm going to support it. But with respect to this and the urgency of this situation, let me say that I agree with Brendan, because we've always had a shortage, and I know people on the other side agree with this, that especially in rural areas, northern areas, we've always had a shortage of primary care practitioners. And certainly under COVID, this is being made worse. A lot of people are burned out, nurses, doctors, and the reality is, given the baby boom, there's a lot of people who are about retirement age. And I think coming out of COVID, that's it. No more. I don't want to do it. And I'm a little in the same position myself, although I jumped ship before COVID, not afterwards. But I know there are a lot of health practitioners who are tired. They need assistance. The healthcare system is struggling as it is. It's going to struggle harder because of an increased shortage of personnel. And there's an urgency to this. And I think a number of us here in the room are on the same page on this. We are a minority government. It takes time to get things done. Why don't we start working on this? Because I think we can hopefully find solutions, and perhaps we can even work together to find solutions, which would be really nice. Yeah, crazy thought. I know. Okay, forget I said that.
Mr. Davies, please.
Thank you, Mr. Chair. Well, first of all, I want to say I've seen a number of studies put forward by every party now. In fact, some parties have put forward more than one. And I think every single one I read has been very important. I can think of 7 or 8 studies that would be easily justifiable as warranting the first study that we proceed with, but we're going to have to only pick one. It doesn't mean we're not going to get to the other studies. Where we've got probably time to get a study and a half done before June, and then we have all fall that we're going to get to. So I think the bottom line is at some point we have to pick a study that's important and we have to get started on it. I don't think that means that the second study or the third or the fourth that we look at is any less important. I'm going to second some things that were said by Dr. Hanley on this. There is clearly a crisis. I think we call it the healthcare human resources crisis in this country. I believe it preceded COVID. I think COVID has exposed it and exacerbated it. But if you talk to the major healthcare stakeholders, they'll tell you that shortages of MRI technicians and family doctors and certain specialists and nurses and nurse practitioners, particularly in rural and Indigenous communities, has been longstanding. So I think it is fully justified as a major priority for this committee. There's a lot of interesting national angles. I think it's a national problem. This is not just a problem that's happening in Saskatchewan, for example, or in Prince Edward Island or Quebec or British Columbia. It's happening in every single province. And I think national problems require national solutions. I would just, in preparation for this meeting, I was reviewing a letter that had been sent by a number of healthcare stakeholders to this committee last year, where they pointed out some of the very useful things that could happen if the federal government convened a national roundtable or having some sort of standing committee to help deal with the issue of the shortage of healthcare professionals. One of the things they thought they could do is develop a national data collection service. Alberta doesn't necessarily know what's going on in Quebec, and any other province doesn't as well. Similarly, not every province is experiencing the same healthcare professional issue in exactly the same way. So for the federal government to convene a coordinating body, I think was the term used, to make sure that all the provinces and territories were funneling data and sharing data on their particular issues was an important thing for the federal government to do. And if the federal government doesn't do that, who will? Nobody else will. As well, I might point out that the federal government, of course, has exclusive jurisdiction over immigration. I think immigration will be one piece of solving this. We use our immigration system when it's working well to attract to our country people with skills and occupations and talents that are needed in our country. So I think that can be explored. I had a meeting last week with the head of the Canadian Medical Association, Dr. Catherine Smart, who they're formally talking about the issue of having a national certification for physicians. With virtual care now, perhaps one doctor who's certified in one province may very well be able to consult or treat or see patients in a different province. So that's another issue that could be looked at on a national level. So I think there's lots of areas to look into this. And as you've seen, one of my motions is to study children's nutrition, which I think Mr. Berthold graciously amended his study motion to include that. So I think children's health is equally worthy of issue, but we have to pick one. And I'll try to break the ice here and just say I'm happy to support the healthcare human resources crisis first, and then we should agree to do the Conservatives' motion second on child health. And Monsieur Thériault and I will be bridesmaids, and we'll pull up the rear at some point. But I think at some point, look, we just got to agree to get going on business. And I don't want to get into a fight over what's first. Something's got to go first. They're both important issues. And so I'm happy to support this motion. I will be moving a motion similar. I'll give notice of this now, that we have equal witnesses for each of the parties. I just want to get that out because...
Point of order. Point of order, Mr. Chair.
Yes, we have a point of order on the floor.
Maybe it's a point of clarification, sir. Are we in a debate, or are we bringing forth other motions? That's all.
We are in a debate on the amendment to the motion. Mr. Davies, go ahead.
Thank you.
Excusez, Monsieur le Président, excusez-moi, Monsieur le Président, il n'y a pas de traduction. Il n'y a pas eu de traduction.
I didn't hear the translators or interpreters, says Mr. Thériault.
Okay.
Député ni de la vôtre, alors...
Neither what you've said nor the previous person.
Prenne son état.
I'd like to hear what the member was saying.
Okay. Est-ce que la traduction marche maintenant? Does the translation work now, Mr. Thériault? Okay. Dr. Ellis, if you could just, for the benefit of Mr. Thériault, if you could just repeat your point. Same.
Thank you, Mr. Chair. I wasn't sure if it was a point of order or clarification, if we were debating or bringing forth more motions. Thank you.
I'm sorry, I'll finish.
And the debate is on the amendment to the motion of Dr. Hanley to remove the reference to it being prioritized. And Mr. Davies has the floor.
Thank you, Mr. Chair. I'll finish up. I was speaking to the motion to amend to remove the prioritization, because I think at some point we got to decide what we're going first on. I'm happy to go first on this, but I just wanted to make it clear that my support for it may be conditional upon how we handle the witness question. Thank you.
Thank you, Mr. Davies. Next up, we have Dr. Ellis.
Thank you, Mr. Chair. Certainly, I want to echo the comments of our colleagues in the sense that we want to get moving on this committee, lest we all look like we have our skate laces tied together. That's never a good thing. For those of you who don't play hockey, I do believe that Mr. Hanley's motion is very, very important, and I've spoken to him offline with respect to that, as well as to Dr. Pawlowski. And being a physician myself, I totally and utterly understand the issues. The only caveat, Mr. Chair, that I would bring forward for our honourable colleagues is the fact that the study on children is unique. The problem with respect to healthcare resources in Canada is a well-known issue. I'm not entirely sure how much we need to study it, because at some point there does need to be action on it, and I'm not sure that studying equates to action. And that would be my biggest issue with respect to that. The future of our country is really reliant upon our children and adolescents. We have no idea of the impact on the health and mental health of children and adolescents related to the impacts of COVID. And therefore, I guess my conclusion would be that starting off with a study related to healthcare resources where we already know there's a giant problem, whereas we do not know the untold effects of children and adolescents. There could be an argument made there, sir, to say that the study on children and adolescents is more pressing than the already known fact that we are short tens of thousands of nurses, perhaps 70,000, and multiple thousands of primary care providers. Therefore, that would be the only thing that I would ask my honourable colleagues to take into consideration, is the urgency of them. The only other thing that I bring forward is if my colleagues, and I'll take them at their word, would say, let's do 6 meetings on the healthcare study and bring forth a children's study second. Let's get moving. Thank you, Mr. Chair.
Thank you, Dr. Ellis. Dr. Hanley, please.
No, I withdraw for now. Thank you.
Monsieur Berthold.
Mr. Berthold.
Monsieur Berthold.
Mr. Berthold? Yes, Mr. Chair. Mr. Chair, this is just to say that I would not want us to debate between what is more important, the nurses and doctors in the healthcare system, and on the other hand, the effect of the pandemic on children. I think it's completely ridiculous to be debating as to what is the largest or most significant priority here. To me, the most important priority is obvious, and I think for a lot of Canadians too. We're really concerned about what's going on with our children, our grandchildren, the effect of the pandemic on them, but also more broadly, we want to go a bit further and understand how the healthcare system and the Canadian public can be more supportive of children. Children, in a way, have been cast aside since the beginning of the pandemic to some degree, and this is why we absolutely need to be able to begin showing them that their members of Parliament actually care about them. I think that's important. We need to be able to start looking at the effects of the pandemic, the effect of school closures, the effect of having been stuck with this in the same space with their parents for a very long time, sometimes with violent parents, sometimes with no other resources to them. That's been the reality for many Canadian families. And as parliamentarians, we just can't turn a blind eye to what happened during the pandemic. And with the support of my colleagues, that is what I would like us to address during the context of studying COVID. Yes, we could look at the effect of COVID. We could look at, the effect on children for 2 meetings on this particular study, and then continue the study after those 6 meetings that my colleague was referring to on human resources. I think that's just as important. I have many things to say on the way the pandemic was managed by the Liberals, and I want to have that opportunity to say these things, whether we're talking about children or managing human resources. The promise to hire 7,500 healthcare workers that we have not even seen the beginnings of. I agree with this. I think we need to discuss this, but I don't think nurses benefit from us tearing our hairs out or debating about this as to whether nurses or kids are more important. I think both are important. So it's a political game here to say, which should be the first study. It's unfortunate. I was very much interested in this. I really wanted us to just close off on my study. The idea of starting with one, starting with the other, both are important to Canadians. We need to be able to change things so that suits everyone. Mr. Chairman? I'll ask my colleagues to speak, but I think we are prepared to vote on my amendment as soon as you so wish.
Oui, il n'y a plus de personnes qui veulent.
No one is on the speaking list yet anymore. Actually, Mr. Lake is next.
Okay. I'm good.
J'avais levé la main, Monsieur le Président.
I had raised my hand, Mr. Chairman. May I speak? I had raised my hand, but you hadn't seen that I'd raised my hand. I had raised it before Mr. Berthold, in fact. Can I speak now, Mr. Chair? Mr. Thériault, I saw the raised hand. You are right after Madame Sidhu. I thought you'd said that there were no more speakers on the list. Madame Sidhu. No, it's just that you said that there was no one left on the list. Okay, that's fine, thanks.
Ms. Kramp-Newman, you have the floor.
I'll defer for now.
Ms. Sidhu. Ms. Sidhu, you have the floor. Okay, we can't hear you, Ms. Sidhu.
Mr. Chair, as long as, because we all know pandemic has strained the healthcare system, and as a result of burnout, the stress rates among healthcare workers, and we have a code orange in Brampton Hospital. So as long as my colleagues are, steady, at HR, a motion by Dr. Brandon. So I'm okay with that. That's why, because there's urgency in there too. And we know children care is also nutrition. It's also important. So that is why I just want to know, as long as we are studying that, that will be okay.
Thank you, Ms. Sidhu. Mr. Thériault, please.
Mr. Thériault, please. Yes, Mr. Chair. On the urgency of what needs to be done, I would be remiss for those colleagues who received the documents but were not involved in previous work of the committee. I would be remiss not to say the following. Quebec and the provinces know full well what the problem is. The shortage, labor shortage, is something that they've been dealing with for a long time. It's a lack of financial resources, and linked with the fact that during the first wave, all healthcare workers, all of them have told us that this chronic underfunding issue of the healthcare networks over the last 30 years had led to such a fragile system that it would be difficult to get through the pandemic. Mr. Thériault's sound is cutting out. Some workers are in very precarious situations in Quebec, and the government of Quebec had to turn around and train people, try to hire 10,000 people. So if we want to talk about emergencies, clearly the provinces and Quebec know full well, whether my colleagues agree with this or not or want to, that there is an issue with having significant structural investments involved there to support those people who for the last 30 years have known what to do with additional funding, the kind of funding that would have allowed them to improve the situation. So we can do a study as a complement, shall we say. My colleague, Mr. Davies, was talking about another important issue. I agree, it's very relevant. When you look at how the government is struggling each year to make sure that our foreign workers can, end up working our fields, and yet we end up in the same situation every year. It really has me begging the question as to this, quote, state of emergency. I understand, however, that regardless of what one may have to say about the order of priority or precedence, this motion will pass. So let's just move to the vote as soon as possible, and then we'll focus on consistency and its inconsistency, and these issues of jurisdiction will all be raised at the right time. That said, I think some of my colleagues have very good intentions, and I think, however, they may be mistaken in the order of government, in the sense that some of the work should be done by leaders in provinces. I'm prepared to vote. That being said, thank you, Mr. Thériault.
Have your hand up.
No one's up here.
Okay, that exhausts the speakers list. So we are now ready for the question on the amendment. So the amendment is to remove the prioritization of this study. Do we have consensus, or do we need to proceed to a standing vote? Can we get some indication in the room as to whether we're all on the same page?
So we're against it.
One hand here.
So a recorded vote, please.
Merci, Monsieur Berthoud. Mr. Clerk, please.
Could I just... Qu'est-ce que je peux juste...
Can I withdraw the motion, or is that not allowed?
Voulez retirer?
Sorry, you want to withdraw the amendment? Correct.
The amendment has been withdrawn. The debate is now on the main motion. Mr. Davies.
Thank you, Mr. Chair. I would like to move an amendment. Near the very end of the motion, after the words "on the study," I think it's the second last part of the motion, to add the words, "and each party be entitled to an equal number of witnesses."
Thank you, Mr. Davies. I was just alerted by the clerks that we require unanimous consent for Mr. Berthoud to withdraw his amendment. So I might have been too quick. Is there any objection? Do we have unanimous consent for Mr. Berthoud to withdraw his amendment? Someone read the room. Mr. Thériault is okay. Mr. Davies is okay. Mr. Van Couverden's okay. Are we okay in the room? Very well. The amendment is again withdrawn, and we now have a new amendment proposed by Mr. Davies with respect to an equal number of witnesses. The debate is on the amendment. After Davies, Mr. Lake.
Mr. Chair, if I just it may make more sense for you to throw this in now in case Mr. Hanley or others speak. Because there were different versions of this motion, I think the last one, it talks about doctors, nurses, nurse practitioners, and other health professionals, I think. I just want to be clear that the motion is broad enough for the committee to be able to examine shortages in professions and areas of
Point of order, Mr. Chair. Point of order.
Yes. Is it Dr. Ellis with the point of order?
Thank you, Mr. Chair. I think the member's already put forth his amendment proposal, and I thought we needed to move on to debate with respect to that, not continuing to add to it. So, I think we need to clean up what we're doing here and get moving forward as opposed to adding. That's my suggestion, sir. I appreciate your time.
Okay, thank you, Dr. Ellis. Mr. Davies can speak to his amendment, and I think I'm hoping that's what he's doing. So go ahead, Mr.
Thank
Davies.
you. Well, that's exactly what I was doing, because obviously the number of witnesses that we call and who we call is dependent on the scope of the study. So I just thought I could wait till later, but I thought, if Mr. Hanley speaks to my motion later on, it would be helpful for me to have him clarify that the healthcare human resource shortages will apply to people beyond those 3 categories mentioned. So if we want to look at, as I said, shortages in perhaps MRI technicians or in physiotherapists or other healthcare allied professionals, that the study is broad enough to look there.
Okay, thank you, Mr. Davies. Next, Mr. Lake, please, on the amendment.
Yeah, I said this earlier in the last meeting, but this idea of apportioning equally the numbers of witnesses by party, I can't tell you how many problems there are with that. First of all, we could get into taking a look at the math around the election campaign, and in the amendment, he doesn't reference, for example, the Green Party. He doesn't reference even, I don't think, official parties or members of the committee. So I'm not sure if every party that ran in the election gets a chance to have an equal number of witnesses. I'm not sure what that means. Secondly, since when do we assign specifically witnesses to specific parties? What party does the Canadian Pediatric Society belong to? And do our witness groups want to be assigned to a specific party? The Canadian Medical Association, what party does the Canadian Medical Association get apportioned to? Typically, our witness lists, we have a conversation by consensus, and yes, we all suggest witnesses, but typically different parties, one organization might be on 3 different parties' witness lists. And we have a conversation as we organize for our committee hearing in terms of what witnesses as a committee we're going to choose to have come. And generally, it's worked well over the years to do that. So again, I don't really understand this idea of apportioning witnesses by party. The other thing that we're allowed to do is witnesses, Canadians, the beauty of this system is Canadians are allowed to write to the chair of the committee through the clerk and ask to appear before the committee. What party? Do they have to declare an affiliation with a party so that they know what party's witness list they're going to be a part of? I think this is just, I don't even understand why this would even be considered. As a committee, surely we can all suggest witnesses. Witnesses can, apply to come before the committee, and then we can have a conversation by consensus, decide who the witnesses are going to be.
Thank you, Mr. Lake. Monsieur Bertod, s'il vous plaît.
Merci beaucoup, Monsieur le Président.
Thank you, Chair. When I had the opportunity to speak to this motion for the other study, that's where we were at the last study. It had to do with the number of witnesses, and I think Mr. Lake is raising an accurate point. Witnesses may not necessarily want to be associated with one of the political parties around the table. How can we then say that one witness is the witness representing this particular party or from this particular party? How can we sincerely say that these people whose right to speak will be withdrawn or whose right to appear before the committee will be withdrawn because they will have made a request and no party will have agreed to their appearance? Does that mean they have no right to appear before the committee, the Standing Committee on Health? Is that what we're really trying to do here? I don't think that's the right approach. As Mr. Lake just said, we have a great tradition. And the precedent Mr. Davies was referring to had to do with one specific study, very broad, adopted by the House of Commons, that had to do with COVID under exceptional circumstances. And each of the meetings was 2 hours long, an hour where each party could present a witness, and another hour where you had the government officials, representatives from Health Canada, the Public Health Agency of Canada, and there were many witnesses. This was exceptional times. I said I was prepared to accept it for children because we're united in that on that cause, but I don't think we could have one person per meeting per party. I think I was prepared to try that for the children's study, but in the context of this current study, I have to say no. I was hoping we could start with a study on children, with a, if you will, a pilot project to see how that would go, to see how we could approach the issue. And I think Mr. Lake was absolutely right. I hadn't even thought of that. You just can't ask people to come and appear before the committee and associate themselves with one particular party. That's not fair to them, and it's not fair to the people that we represent. We have to think about this. On the witness lists, we have to think about it, find a way to have everyone invite witnesses, but do it by consensus. In fact, I've never had this problem in any other committee. That's always worked very well. I think we should continue in that way. As I mentioned, I was prepared to try it. Unfortunately, the negatives are outweighing the positive effects of this solution, Mr. Chair.
See, Mr. Berthoud, Dr. Ellis, please.
Thank you, Mr. Chair. Certainly I want to echo the comments of my colleagues. This Westminster system that we have is imperfect. Democracy is messy. However, it appears around the world this is one of the best systems that we actually have. I think we need to respect those traditions and not to be too coy, but if Mr. Davies would like to join our party, then he could have more witnesses. That's just the way it works. And he could have more time. Again, I don't mean to be nasty, but we need to get on with the business, Mr. Chair, and trying to rig the rules and gerrymander certain things so that we can get more time is just utterly ridiculous in my opinion, sir. And therefore, I think we need to stick to the traditions that we have, get on with Dr. Hanley's study, and get this committee moving because we're mired up to our necks in ridiculousness. So thank you, sir.
Thank you, Dr. Ellis. Ms. Cramp-Newman, please.
I think if this was invigorating and healthy and productive conversation, I wouldn't be so frustrated, but this has been a colossal waste of over an hour, a colossal waste of all of our time, our staff's time, and the Canadians that are listening. So I really think that we're playing politics with Canadians, and we should step up and know better than this. It's disappointing. So there's a lot of really good motions at hand from all parties. And I don't think the question is we're arguing too much who's going to go first, who's the priority. When realistically, let's talk about all the motions that we have. These are all important motions or studies. And I just think that let's get all the studies out on the table and then prioritize who's going to go first. But let's get moving. I think this is an embarrassment, and we need to move forward.
Dr. Pawlowski, please.
Well, somebody spoke to tradition, and the tradition in this committee is each party gets an equal number of witnesses. You guys weren't in the committee last time, so how do you know? So that has been the tradition. Yes, strategically, we like to keep Dawn happy, but you know what? In addition, I have to say, and here's a shout out to you, Dawn. Dawn has some of the best witnesses, even better than some of the Liberal witnesses, if I may say so. And so that's why I'm really happy. And Luke has good witnesses too. And you guys are absolutely right. A lot of the people who come as witnesses before the committee don't and shouldn't have a political ideology. But in choosing people, I find Don really does his homework. I think those of us who've worked with Don for a while know that. And so I'm happy to give Don an equal number of witnesses. Thanks.
Thank you. Mr. Davies, please.
I don't know if Mr. Theriault, I see his hand up. I'm prepared to defer if he was waiting to speak. If not, I will go now, but I see Mr. Theriault's hand up. No?
Mr. Davies, the speaking order that I have.
I'm sorry.
Mr. Davies, the speaking order that I have is you, and then Mr. Van Koeverden, and then Mr. Theriault in that order.
Thank you. I'm sorry, Mr. Chair. I should let you, of course, govern that. I apologize. Well, just a few points. I mean, there's reasons, of course, to support this, my amendment, and reasons not to. There's, as with every motion, there's pros and cons. But I do think it's important that however we vote based on fact. And now the first thing is, there's nothing in my motion that says that any of the witnesses that we're putting forward are representing anybody. So what we do is, the way that all committees work, the way that witnesses come before us is each party submits lists of witnesses. That doesn't mean those witnesses are conservative witnesses or liberal witnesses or NDP or Bloc witnesses. My motion just speaks to how we develop the list of witnesses that will be allowed to testify. And I'm just saying that each party be entitled to submit an equal number of witnesses, so we hear from an equal number of them. So any suggestion by my conservative friends that this makes these witnesses compromised in any way is simply wrong. Second of all, I take Mr. Lake's comment somewhat seriously about the parties, but I think it was understood that when I said each party be entitled to an equal number of witnesses, that I mean the party represented on the committee. But I think that would go without saying. What other parties would we be talking about? The Rhinoceros Party? Of course, it's the parties on the committee. I think we all can understand that. In terms of what's interesting to me is, let me read from the motion that my conservative friends voted in favor of about 23 months ago. This was the motion in the House for Health Committee on the COVID study that this committee spent from February of 2020 until this committee was dissolved for the election. That was over 18 months. This is the motion they voted for, that each party represented on the committee be entitled to select one witness per 1 hour witness panel and 2 witnesses per 2 hour witness panel. That's what the Conservatives voted in favor of, equality of witnesses. So the umbrage that's being taken today to a concept that they wholeheartedly supported last Parliament for almost the entirety of the of last Parliament at the Health Committee is a little bit rich for me. By the way, I believe in Mr. Mr. Thériault might correct me on this. I believe we also had equality of witnesses when we did the PMPRB study as well. So for the entire 43rd Parliament at the Health Committee, each party submitted an equal number of witnesses. Now, in terms of duplication of witnesses, that can happen at any time. We all put forward our witnesses and then we look at them, and if there's overlap, well, that's fine. They can count as the clerk then attributes them to one party or the other. I would also say that I must correct my colleague, Mr. Berthold. I don't know where I've corrected him on this before. He continues to suggest that last Parliament, there was the first hour was for equality of witnesses and the second hour was for government officials. That's simply incorrect. That's simply wrong. We had most of our meetings, 90% of our meetings, 2-hour meetings, where we had just the regular witnesses at them. Might I just say, if we're talking turkey here, this is all about how we determine what witnesses come before this committee, and I'm proposing that each party be treated the same. I'm going to also say that my good friend, Monsieur Thériault, also brings excellent witnesses forward that have a unique perspective. And really, I think what we want to do at this committee is make sure that we have a diversity of opinion from a variety of perspectives to inform the committee's deliberations. And, the Conservatives having 40% of the witnesses and Liberals having 40% of the witnesses doesn't give the same diversity as 25 does. And I just want to conclude by thanking my good friend, Dr. Pawlowski, for that. It is my intention to do my best to bring forth witnesses, as I'm sure all of us should be, that will add informed positions before the committee that hopefully we can to the committee that other parties or members may not be aware of, so that we can again enrich the discussion and the evidence before the committee, so that when we do write reports, it is as informed and diverse as possible. And that is my sole goal in doing this. Thank you.
Thank you, Mr. Davies. Monsieur Thériault, s'il vous plaît.
Merci.
Thank you, Mr. Chair. I won't repeat what Mr. Davies just said, but I would add the following to reassure my Conservative colleagues. It has happened that witnesses we had put forward, who were not Bloc witnesses specifically, but it facilitated the work of clerks. It facilitated the work of research analysts because we were doing the work of trying to find relevant witnesses. It has happened frequently that Conservative colleagues have found the very witnesses. Unfortunately, the sound just cut out for the interpreter. It's not as though someone said, this is the witness from the NDP or from the Bloc, but it has often happened that the Conservatives would ask questions, and I was pleased, ask questions of the witnesses that we had put forward that did have a unique perspective. And that worked very well. So really, it's not a partisan issue. This is about making sure that things go well in our meetings. Sometimes witnesses don't show up or send their regrets. And when we have a responsibility to provide witnesses, sure, we also have the responsibility to do that, but also to find other witnesses. It's a group effort to try to find as many witnesses as possible. I'm not sure I'd fully understood my colleague's points. I'm not sure which Conservative colleague raised this, but if we were to now have a discussion as to prioritizing witnesses, good luck. If we can start by establishing that we are all responsible for putting forward names of witnesses and that these witnesses will be heard, I think that settles some of these really technical issues, and then we can get to the actual substance of the matter as soon as possible. I personally can say that I've felt that this is how things have worked, at least for me, for the last 2.5 years. It's very effective. Everyone's happy with that way of doing things. So I would urge you to vote for this proposal. Thank you.
Dr. Lake, please.
Let's just be clear. There is no way that if this meeting ends at its scheduled time that this will come to a vote, because it is a non-starter for me, an absolute non-starter for me to allow this situation. And I don't, this is not a long-term tradition, as one of the members said. I find it a little bit confusing not having members' names in front of us here. So maybe, Chair, for future reference, we could get back to some nameplates so I can know who our new members are. The fellow across the way said that, a direct quote that strategically we like to keep Don happy. Well, my mission on the committee is to get our health decisions right for Canadians, not to keep Don happy. And I like Don, but that's not my mission. That's not my mission on this committee. And there is no way that I could go back to my riding and explain that I allowed in my riding that I allowed 25% of the witnesses for Canada's Health Committee to be chosen by the Bloc, a party that got 7.6% of the vote and has 8.3 or 9.5% of the seats. There's just no way in my riding. Surely everybody on this committee understands that there's no way I could even go back to my riding and explain that I played any part in allowing that to happen. That just will not happen. So, I'm here today, and I will be putting my hand back up on the list to weigh back in as long as we're having this conversation, because that is a non-starter. And Don, to Don's point, talking about equality of witnesses, listen, all of the witnesses that come before the committee are equal. This is not about equality of witnesses. The witnesses that come before the committee are equal. And I think Canadians expect our committee to take a principled approach to this, to be able to come to some consensus to make sure that we've got a wide range of witnesses. Certainly, Don, I would get the point that with 7.4% of the seats and 17.8% of the vote in the country, that you might have a point to say, hey, we should maybe get 17.8%. We should have that taken into consideration as we choose our witness lists by consensus. I'm all for that. But this idea of just saying that every party is going to put out equal number of of witnesses, and that we're going to choose 25% of our witnesses based on suggestions. And this is no offense to the people that voted for the bloc. We live in a democracy here right now, and 33% of Canadians voted for our party, and those people that voted for our party are not going to accept my decision to allow in any way 25% of the witnesses in this committee to come from a party that's dedicated to separating from the country. Like, that's just not going to happen. Sorry. I can't even believe that my Liberal colleagues are taking part in this conversation. It's unfathomable to me.
All right, next we have Dr. Ellis, please.
Thank you, Mr. Chair. I certainly want to echo the comments of my colleague, Mr. Lake. You know, this is unconscionable. Oftentimes, we look back at the history of Canada, we understand how we got here as the great nation that we are. And I also understand that there are people out there who continuously, like in the Ukraine, want to fight and die for their own democracy, with the Russians at the gate of exactly their border at the current time, with a miserable 400 Canadians moving westward and not protecting them. I think this is a travesty. You know, I had great hope for this committee. I spoke to my other two doctor colleagues here and really wanted to do some work in this committee. And you know what? I know that Dr. Hanley and Dr. Pawlowski feel the exact same way, and not to disrespect any of the other colleagues, but I've had specific conversations with these two colleagues. And I do believe that there's an expectation that Canadians want us to get something done here. And I think this continuous back and forth bickering and pandering and ridiculousness that we're experiencing at the current time is utterly untenable in the goings-on of this committee. How can we ever expect to get anything done when all we want to do is fight over the rules? When we know that we have had committee rules, and I know that I haven't been here very long, but there are committee rules that have existed that you can look up in Bosch and Gagnon, or wherever you want to look them up, that have been there for many, many years. And that tradition is the tradition which I speak of. I don't speak of the tradition of the 43rd Parliament. If someone wants to go out there and fiddle and, as I said previously, gerrymander things, that's totally up to them. They can do that. However, when we have 4 different people here on our side of the House, and this is a decision that we want to make just simply because people were here previously and that's what they used to do, does that make it right? No. I think that we have an opportunity here to make things right, and I also believe very clearly that, you know, if you want to take this to the extreme, you know, we could have had a majority government sitting over here as Conservatives, and certainly talking about any of this foolishness would have been out the window. So trying to say what happened in the 43rd Parliament is not any benefit to me whatsoever. So again, I implore this committee to get some work done, stop talking about the minutiae of foolishness, and understand that we have a long-standing tradition of the Westminster style of government, which is why we're all here, celebrating 70 years of the Queen at the throne and continuing on with those great traditions that have made us a great nation. So in order to continue to sit here, I think it's important that we ask for unanimous consent for Mr. Davies to withdraw his motion, to think that there can be equal numbers of witnesses and that we get to the traditions that we've all been here to represent, as Mr. Lake quite eloquently pointed out. So continuing to do this, if we choose to speak on this motion for hours and hours, that's perfectly fine by me. I don't have an issue with that, because, you know what, I have also chosen to serve this country. You know what, I spent 9 years of my life in the military, 4 years of those in active service, 4 months of those in the Middle East, serving our country in op determination. So when you look at those things, and for those of us who have decided to wear the uniform, and yes, it's a choice, then I think that to come here and misrepresent those values which we all want to push forward is an absolute travesty, Mr. Chair. So allowing this kind of talk to continue is just unfathomable to me. And I would have to say, as Mr. Lake said, that the choice here to look at the things that have been done previously and then have to go back and represent them to your riding is unconscionable to me as well, sir. So if that's the debate that we want to continue to have today and not get any work done, I say, let's have at her, as we might say, coming from Eastern Canada. So, that being said, I vehemently oppose. I ask my learned colleague, Mr. Davies, to withdraw his amendment, and we ask for unanimous consent, and let's get some work done. Thank you, Mr. Chair.
Thank you, Dr. Ellis. Dr. Pawlowski, please.
Well, before getting things done and calling a vote, which would get us one step closer to actually doing something here, I did want to respond to the allegations from the other side and the suggestion, well, all the Conservatives are all about like getting the best witnesses here, and it's the Liberals who are playing politics on this. Well, one of the reasons that I support Don's motion is because I think that the Bloc and the NDP often had pretty good witnesses they called. But I would say, and I don't blame you all for this because I know none of you were on the Health Committee last year or the last term, but I do say, and I sat through, along with Sonia, we sat through a lot of meetings on Health Committee, and I have to say that there were a fair number of witnesses that appeared that were brought in by the PCs who were very partisan. And they were there for a political message rather than trying to get us to a better understanding of the issue. And so that's, if I like this idea, it's in part in response to the PC's previous choice of witnesses. I hate to say, and with that, I'll call for a vote on the amendment.
We will go to a vote when the speakers list is exhausted.
Oh, sorry, I wasn't even recording.
We have two people. We have two people still on the speakers list. Et la prochaine est Monsieur Thériault.
The next is Mr. Thériault.
Président, je vais faire ça vite.
I'll be brief. I'm quite disappointed to hear what my Conservative friends are saying. If Mr. Lake can't go back to his own riding and you know, that the Bloc would get 25% of witnesses. I think if he looked at the list of witnesses, he would realize that there are many witnesses that the Bloc proposed that were proposed by all four parties. And there were witnesses who could not be put forward by Mr. Lake because he did not know of their existence and because he does not have any members of his riding in Quebec. If he can't go back to his riding and say that he would have allowed the Bloc witnesses to propose witnesses, that does not mean that we would hear from them, but that they would have the equal share of the proposal of witnesses. I can assure you that I can go back to my riding and certainly tell the people in my riding what he's just said, and people will just not understand what he means. When the Conservative Party claims that it understands the Quebec nation. I'll stop here before I cast any aspersions, but from what I'm hearing now, I have to say it's a bit of a problem here. I hope we'll be able to be more serene. I've always been focused on moving forward and being as effective as possible, and in that regard, it's not really a matter of me getting 25%. It's not often the case. Actually, it's 100% because everyone had the same witnesses at the end of the day. That being said, I'll stop here. I'm prepared to vote.
Merci, Mr. Thériault.
Thank you, Mr. Thériault.
Oh, well, just a few things. Again, the issue of bringing up what this committee did in last Parliament isn't because I'm asserting that what we did in the 43rd Parliament means that that's what we have to do now. I pointed that out in response to those that say that they have said somewhat erroneously that committees don't adopt any a system where each party is entitled to submit an equal number of witnesses. And by the way, so I just brought up the example where this very committee did that the entire last Parliament. So I'm offering that as an example where it is done. And by the way, I have said this before, there are other committees in Parliament that do that as well. I think in fairness, I think it's true that the majority of committees probably distribute witnesses in proportion to the seats in House of Commons, but not all do. The other thing I would point out, of course, is that committees are the master of our own process. We can do whatever we want. I am disappointed in this, and I can't help but point out the complete logical fallacy of at least 2 Conservative members expressing frustration at the fact that we're taking time at this, and they just really want to get on with doing the people's business, at the same time threatening to continue to unless they get their way. For any Canadians watching this, I think they can easily see through that. Look, we're in a minority parliament. In minority parliaments, it requires cooperation between the parties to get things done. And in this case here, I don't think it's asking very much for us to say, look, this is Health Committee. I've said this before. One of the reasons I very much enjoy the Health Committee is because generally the issues are nonpartisan. We are all working for the health of Canadians. That's what everybody says. To bring partisan interest in, I would venture to say it's really the Conservatives who are bringing partisanship in, because what they really want is 40% of the witnesses, and are unwilling, it appears, to provide each party with the opportunity to have the same number of witnesses. Mr. Lake asks, what do I expect them to say to his constituents? I would say whatever he said in 2020. I have to go back and check the vote, but I'm pretty sure he voted in favor of the motion that provided equality of witnesses to this Health Committee then. If he didn't, I apologize to him, but I'm pretty sure he did, because the Conservatives supported that. So,
Point of order, Mr. Chair.
Sorry, there's
yes, Mr. Lake.
Yeah,
point of order. Yeah.
The point of order is that it wasn't this Health Committee. This is a different Health Committee in a different Parliament.
Go ahead, Mr. Davies.
So that's not a point of order. That's an item of debate. But
right. Go ahead.
My point, the thin distinctions that are being made here. My point is that this Parliament and the Conservatives supported equality of witnesses before, and in terms of getting over the apparently extraordinarily difficult philosophical problem that Mr. Lake has and the good doctor has with the Westminster system. I don't know, the Conservatives did it last time. And you know why they did it last time? Let's talk turkey. Because it was Michelle Rempel-Garner's motion. And if the motion passed, she accepted some amendments. So that's why it worked. That's why they voted in favor. And they didn't have, the Conservatives had no great philosophical or principled reasons to oppose equality of witnesses by parties then. They were very prepared to sacrifice the principles of the Westminster system when it was their own motion. So, enough of this principled stuff. What they're doing here is they're threatening to filibuster the Health Committee and stop the good work of this committee in a time of COVID, in a time when we want to study children's health, in a time when we want to address the terrible burnout of our frontline healthcare workers. And you've heard it. The Conservatives saying that they will talk out the clock and filibuster rather than give each party at this committee the same opportunity to put witnesses forward, when they have been told repeatedly by people who sat on this committee, Dr. Pawlowski, Monsieur Thériault, me, that it worked extraordinarily well, and all it did was bring good witnesses before this committee. So the only partisanship that I'm seeing here is Conservatives who don't want to let go of their ability to use their muscle to get conservative-oriented witnesses before this committee. That's what this is about. Incidentally, I also want to say, if we're respecting the Westminster system, why did the Conservatives and Mr. Berthold spend all this time trying to get their motion to study children's health first? They don't have the most number of seats. The Liberals do. So I guess the Westminster system, the principles of number of seats, only works when it benefits the Conservatives, and they easily dispense with when it doesn't. So I'll tell you, I am not withdrawing this motion. And you know what? I want to vote on this motion. This is going to be the last thing I say on this, because I want to vote so that we can get to the important issues of the day. And I'll leave it to the Conservatives to decide if they want to make a political decision to filibuster and waste time and not let the Health Committee of the House of Commons study these important issues, because they don't want to give each party the opportunity to have an equal number of witnesses at this committee. Then the delay of this committee squarely on the Conservatives. Thank you, Mr. Chair.
Thank you, Mr. Davies. Mr. Van Couverton.
Thank you, Mr. Chair. Look, we need to get along on this committee. We need to work this out, and we need to get to the business of serving Canadians. I fully agree with Ms. Cramp Newman, and I wasn't even here for the first 45 minutes because I was talking about the cell phone data in the House of Commons, and I find it like a little bit, like absurd to say that it's undemocratic. Like, it's democratic to have a vote right now. Everyone, let's just have a vote on it. This is one study. If we don't like it, if it doesn't work, then we'll review it for the next study. We're not changing the constitution of this committee. We're not arguing about, how this committee is going to do its business for the next year or 2 years. It's for one study. And I think it's in the spirit of, making it less partisan, working together. We are going to call mutual witnesses to testify here. We are going to have, witnesses in common. We're going to hear from nurses. We're going to hear from doctors. We're going to hear from physicians' assistants and nurse practitioners. And, with all due respect to Mr. Lake, we had this discussion before you arrived, and you're a huge addition to this committee because you've been working on issues pertinent to health and mental health for so long, but we need to get on with it. And we can only get on with it if we vote. And that's the democratic thing to do here. If it doesn't work, then I think we can have a discussion offline and say, hey, that was a mistake. We'll do something different next time. There's about 4 witnesses per meeting, and to select one from each party, it's fine. I think it's going to work really, really well. So I hope we can get on with it. Try something a little bit new for those of us who haven't tried this before. And for those who were on the committee last time, carry on with what was working. Hope we can vote.
Ms. Cramp Newman?
That's good.
With respect for those of you that are not familiar with my past, my father served as a federal member of parliament from 2004 to 2015. So I had plenty of opportunity to listen and watch him. He is a huge role model to me, and how he did business and how he acted. And he always took so much pride and shared with me before I was elected that the most productive work is at the committee level. From time to time, there can be the theatrics of question period, and then sometimes there are more or less sound bites. But he spoke so highly of so many members on all the opposing parties and really encouraged me to work productively at the committee level. And I really take a lot of pride in that. I think that we can recognize the tradition and the precedent that this country is based on and this political system is based on, and we need to set the tone. We could have been halfway through a study by now, and it's disappointing. So I reckon that a lot of conversations, a lot of studies are important. I don't think us arguing which debate or which study is more important is the situation here. We need to set the tone of some collaboration and some cooperation and move forward.
Thank you. Mr. Berthoud, s'il vous plaît.
Merci beaucoup, Monsieur le Président. Monsieur le Président.
Thank you, Mr. Chair. We've been talking about collaboration, consultation, nonpartisanship. Since 2015, I have sat on a number of committees studying a number of topics, and I've never ever heard any party complain about the number of witnesses taking part in our studies. We would always manage to find consensus. We were always able to have good witnesses before us, sharing good ideas without necessarily having to say, okay, only one witness per party, or I could have 3 excellent witnesses and agree with my colleagues to hear from these various witnesses on this given day. I'm just wondering why we just can't continue in the same vein. I have no desire to not hear the witnesses that Mr. Davies would put forward. I just want to make sure that this committee can work with the best available witnesses. Give the analysts an opportunity to give us a list of witnesses, as we usually do, people that might not necessarily be individuals we might have individually identified. We could come up with panels that would have a purpose, that everyone's really focusing on the same thing, that we're not talking about nutrition to pediatrics in the same study, that each witness testimony can be of service to other witness testimonies. And that's how we've done business, and it's always gone well. I just don't see why all of a sudden my colleagues, the Liberals, would have any desire to change this formula. I understand for Mr. Davies, I understand why he's putting this forward for a party that has fewer representatives at the House of Commons. I can understand that. But when I look at the people around the table, the people who've elected us, we're far higher number than the colleagues of those other parties, and that's fine. We're talking about the Westminster system, democracy. That's fine and well. Democracy has spoken and has led to the fact that the number of representatives here around the table were chosen by Canadians to come to Parliament and represent them. I think it's normal that we should operate in this way. And I have no objection to this. I will often support Mr. Thériault. I will often want to have witnesses from Quebec, witnesses that speak French. He knows full well. We've had an opportunity to have this discussion. We have excellent experts that can cover any topic that could appear before this committee. I'm sure that my witnesses and Mr. Thériault's witnesses will likely often be the same. But do we absolutely have to choose and set them on individual lists? I think that Mr. Thériault has to provide the best witness list. I have to provide the best witness list I can provide. And he might have some great ideas of people that to invite that I might not have thought of inviting. So I think that's the way we should do business in this committee. We shouldn't set rules and more rules and end up having something that's unmanageable. It might have worked fine in the previous government, but what I would like would be for us to be able to work together in a consultative way. I think that's important. We were able to withdraw a motion regarding that first study. I think it shows that we can work together when we need to work on something together. But the idea of adding more rules to this process, I think, limits this committee's capacity to engage in good studies, the capacity of us getting the best witnesses available. And honestly, it's already happened in a committee where I sat there for 2 hours. There were 4 witnesses that were all from the same, that were proposed by the same party. That wasn't a problem because it advanced the discussion. So why set limits in all these rules? I urge you to really consider this. We're able to operate. We've shown that, and we can continue doing things. But what, we're going to have more rules? The first study, it has to be in the motion, and then the number of committees has to be in the motion. We'll be starting from scratch every time because the motion on child care is there's the same motion from Mr. Davies. It's exactly the same on the number of witnesses, and then we're going to deal with this one now and deal with the rest later. That's exactly what I was trying to do. We're going to try with one study. Unfortunately, it's now in every motion. Listen, that argument just doesn't hold water that we're going to try with one because unfortunately we've been unable to agree on an order of precedence. We've been unable to say, okay, we'll try this, we'll see how it works. No, because everyone wants their own study. Everyone wants things to go quickly. But that's not how things work. Unfortunately, now we've almost been here for 2 hours. We've just been chatting, and we haven't even finished we haven't managed to pass one resolution. Last time, we had a motion to discuss the children's issues, and we were unable to do this. And today, here we are, unable to do things because why? We want to add rules to this process. I would highly urge you to consider your vote on this so that we can move on to something else and that we can agree on something that we have consensus. I'm quite certain I'll support some excellent witnesses from Mr. Davies' region that I'm going to want to hear before this committee. I'm sure of that. But I'm also sure that there will be excellent witnesses from Quebec. Mr. Davies, you're going to want to hear. My colleague, Mr. Hanley, you might not have considered inviting them because you don't know them. That's how we should work in this committee. In closing, just really to get back to Mr. Thériault, who was talking about the Conservative Party that has a hard time recognizing the Quebec nation, I would point out that the Quebec nation has brought people from the Conservative Party to Ottawa. As far as the number of voices or votes, I don't think you can appropriate the Quebec nation for yourself. I'm proud to represent the Quebec nation as well, Mr. Thériault. And my comments and my colleagues' comments are here to support that. I just wanted to say that. It doesn't mean, Mr. Thériault, that the fact that you're from the Bloc Québécois, this is a party that aspires to separation. That doesn't mean we have to share the same goals, but we can agree on the fact that we do want to defend the Quebec nation. We recognize it in the Conservative Party. We might not share the same ends, but as far as defending the Quebec nation, I really don't think I need to take any lessons from the Bloc Québécois. We're going to continue to do our work, and hopefully together. If we can manage to, if we can start a study, we'll do so together. We'll hear from Quebec Witness. We'll share our skills with all of our colleagues. I think we can agree on this because I think we have a lot of expertise and talent in Quebec.
Merci, Monsieur Berthold.
Thank you, Mr. Berthold.
Please.
Could I start by getting the clerk to read the amended motion as it would be amended?
Mr. Clerk?
Yes, I would ask Mr. Davies to perhaps clarify after which words he would be inserting and each party be entitled and so forth.
Yes, it was near the end of the motion where the last words were on the study. I think it was in the second last paragraph, if you can find it. Or...
That is clear enough for me. Thank you, Mr. Davies.
Thank you.
So I will read the amendment and then I will read the motion as it would be amended. So Mr. Davies moved to add after the words that the committee hold a minimum of 8 meetings with witnesses on this study, the following words, and each party be entitled to an equal amount of witnesses. So the motion, if it were amended, would read as follows. That pursuant to Standing Order 1082, the committee, in recognition of exhaustion and burnout amongst healthcare professionals, undertake a study on how the federal government can facilitate the recruitment and retention of nurses, nurse practitioners, and other healthcare providers to the public healthcare system, including a focus on rural and northern communities. That this study be prioritized by the House of Commons Standing Committee on Health in the 44th Parliament. That the committee invite experts and representatives to appear. That the committee hold a minimum of 8 meetings with witnesses on this study. That this study be prioritized by the House of Commons Standing Committee on Health in the 44th Parliament. That the committee present its findings and recommendations to the House, and that pursuant to Standing Order 109, the committee request a comprehensive response to the report by the government.
What? Just the amendment itself?
Mr. Davies moved to add after the words that the committee hold a minimum of 8 meetings on the following words, and each entitled to an equal amount of witnesses.
So I'll just move a sub-amendment to replace the word party with member of the committee.
All right. Just, Mr. Lake,
sorry.
Just let me take advice on whether that's in order. I believe it is. Okay, just bear with me, Mr. Lake. My gut was it seems to be confirmed that it changes the substance of the amendment, but I'm consulting with the table on it. Just 1 minute. Colleagues, I'm going to suspend for 5 minutes to take advice on whether the motion is, whether the amendment is in order. So we stand suspended. We'll be back in 5 minutes.
interesting here. Don throws around this equality of witnesses over and over again, but the point I'm making is if every member of Parliament on the committee, every member of the committee had an equal number of witnesses, we would have an equality of witnesses, just as Mr. Davies is proposing. If you take to his extension the arguments he's making in terms of democracy and equality, then regardless of the outcome in the last election, where the NDP got 17.8% and the Bloc got 7.6% of the votes, why not just have equal seats in the House of Commons? Why wouldn't the Bloc and the NDP and the Liberals and the Conservatives all just get the same number of seats in the interest of equality of parties? Why wouldn't we just have an equal number of seats on the committee if we're talking about equality? Why wouldn't everybody just get the same number of seats on the committee? Why wouldn't we all get an equal amount of time in terms of questioning witnesses? I don't understand the principle. This principle just flies in the face of the Westminster system, in the face of democracy. I've been here 16 years. I'm not sure I think Don might be, I don't know if he's the same, 14 years maybe, pretty close. Been here a long time. We've both been here a long time. We actually get along, usually, not on this. I was parliamentary secretary to the industry minister for 8 years, so similar position to what Adam's in right now. And you can go back and talk to your colleagues, to my Liberal friends, Frank Valeriot and Martha Hall Finley and Mark Garneau. They were, on committees with me. In the NDP's case, Brian Massey and Glenn Thibault, some pretty reasonable people. And I think all of them would say that we took a very cooperative approach on committee. Certainly, of course, we represent different constituencies and we, work within different parties, and we have. There are partisan considerations in that sense in terms of the conversations that we have and the approach we have in committee, but never have I seen an approach that talks about, and again, using Don's terminology, partisan interests, never have I seen an approach that actually would attach the party name specifically to witnesses. That seems about as partisan as it gets. And, it's not something that I understand. We have the ability down the road to make whatever decision we want to make as a committee, but it seems to me the Health Committee, when I'm taking a look at these studies that we have before us from members of all parties on children's health, on the public service, on substance abuse, on the 988 suicide prevention hotline, we've got all of these issues before us, and of course our COVID response. We've got all of these issues before us that are so critically important, and I think all of us look at these. We've had conversations, we've had some side conversations where we're all in agreement that these are really, really important and that we need to move forward. If we're going to make the argument that something partisan is being thrown into the mix, a partisan wrench is being thrown into the mix, it's this amendment right now that would attach political party names to witnesses coming before committee. I've never seen that before, and once again, I think that we have to get to a place where we recommend witnesses. We might each recommend witnesses that don't necessarily affiliate with our party. I don't want to be tied to a place where the witnesses we recommend are tied to my party name. I want to be at a place where we might put forward a list of witnesses, including some that we have relationships with that they might not be hardcore conservatives, but we might put them forward anyway because we think that they have good ideas. And we think that it would be a good idea for them to come to the committee. And the Liberals may have them on their list too, and the Bloc may have them on their list too. And then we agree that that would be a great witness because we're all in agreement. That's the way that I think this committee should operate, of all committees in the House of Commons. And, I just can't possibly support this amendment for those reasons.
Thank you, Mr. Lake. Colleagues, we've now reached the hour that was designated for the end of the meeting. We can go another 10 or 15 minutes with the House resources that are available to us, but I'm prepared to entertain a motion for adjournment if anyone is inclined to make it over the next 10 or 15 minutes. And the next person on the speaker's list is Dr. Ellis.
Thank you, Mr. Chair. I think the important thing here is my colleague, Mr. Davies, talks about partisanship and the spirit of cooperation. I find, as I often hear from my Liberal colleagues across the aisle when we're in the House, that's a bit rich, considering the fact that he is the one who has proposed this motion, which has caused this great amount of contention. He also talks about those of us on this side of the committee room wanting to filibuster this issue. However, I would suggest when you look at the answer, the person with the most words that may be there today would be Mr. Davies himself. So given those two scenarios, I find this really something that's quite incredible, Mr. Chair, in the sense that Mr. Davies also is adamant that he will not withdraw this motion in the good faith that the Conservative team on this side also did for an amendment which we realized very early on was without merit and certainly maybe not without merit. Maybe that's a strong word. I'm not crossing the floor, Monsieur Berthold. Don't worry. But we realized in the spirit of cooperation in getting work done here that would be an important thing to do, and therefore we agreed to it. That being said, if Mr. Davies is willing to withdraw his motion, it appears he's dug his heels in on this, which I find inappropriate. That certainly we would support unanimous consent for that idea that he withdraw his motion and continue on with those good rules and conduct so that we can get the work done of this committee as we want to do. Thank you, Mr. Chair.
Thank you, Dr. Ellis. Dr. Hanley, please.
Thank you. I forgot I was on the speakers list, but I did want to, in the spirit of what Ms. Kramp-Newman has said very well, that we really want to collaborate and get things done. And I really feel that if we walk out of this meeting without having passed this motion, then I certainly feel badly for Canadians. I think back to what Mr. Van Koeverden had said, that let's do it for this study in the spirit of collaboration, and let's get on with it. I personally, for the record, have no issue with a strong representation from each party to allow us to have a really make sure that everyone feels heard. Even though I agree, there's likely going to be tremendous overlap of witnesses. En incluant une forte,
including a strong voice from Quebec. Whether it's a Conservative or Bloc Québécois, I think it's important to have a strong voice from Quebec for these studies as well.
Mr. Davies, please.
Well, just a couple of quick points. First, again, I just really want to reassure Mr. Lake that nobody is talking about attaching names to witnesses. We're simply talking about what is the process for funneling names to the clerk and witnesses who will testify. There's no labels attached to anybody. The interesting thing to me is that I'm having difficulty understand my Conservative colleagues' arguments, because they have interchangeably argued that this is a fundamental offense to the Westminster system, at the same time that Mr. Berthold has publicly acknowledged that he was prepared to agree to it with respect to the Conservative study on child health. So I'm having difficulty understanding that we're simply talking about doing the same thing for a different study. I thought Mr. Van Koeverden was very, very persuasive and eloquent in that nobody's asking to get married here. We're talking about a study, and and attempting to have a fair allotment of witnesses. And my final question is this: if we want to find out who's doing the filibustering and who's not, then let's go to a vote right now. And if we talk democracy, ultimately, here's the basis of the Westminster system: is we settled issues by majority vote. So if the Conservatives believe in the Westminster system and you're not doing the filibuster, then I look forward to there being silence after I speak, and let's go to a vote.
Thank you, Mr. Davies. Mr. Berthold.
Merci beaucoup, monsieur.
Thank you very much, Mr. Chair. Mr. Chair, in a spirit of cooperation, we had indeed proposed approaching things in that way. Unfortunately, my colleague decided to present the same motion for a second study, and unfortunately at this point we're dealing with the same motion in two studies and two motions that are not done. We weren't able to pass either because we're still having these procedural debates. Mr. Chair, I would propose the following. For Canadians to be able to take some time to breathe and for us to get an opportunity to speak amongst ourselves and arrive at a consensus, I will present the following motion that the meeting be now adjourned. Thank you, Mr. Berthold.
Is not debatable. Is it the will of the committee to adjourn the meeting? Do we have consensus? Do we need a standing vote? What's the read in the room?
We have agreement in the room, sir.
I see that, and we have agreement on the screen. The meeting is adjourned. Have a good evening, everyone.